Hi, I'm Iniba, and thank you so much for tuning in. From the very beginning, our healthcare workers have been working tirelessly during the pandemic, sometimes without enough medical supplies or even equipment. We should recognize their unselfish and caring nature all the time, but most especially now. Joining us today is Jollene Levid, who found the necessity to do this and created the Kanlungan project, which honors and recognizes our frontliners, most especially those who have passed away from the coronavirus. I really wanted to have you on because I heard about this project that you created, the Kanlungan project. I hope I'm saying that right. Can you tell us a little bit more?
Sure. So Kanlungan.net is a website that serves as a digital memorial to all healthcare workers of Philippine ancestry around the world that have fallen to COVID. It's also what I like to call a data home, so that you could actually see the names of the healthcare workers, the countries that they were in, and then like links to their stories and their GoFundMes.
Yeah.
Um, it's meant to properly honor our fallen.
Yes. How did you come up with the idea?
Sure. So, unfortunately, two of my mother's close friends who were registered nurses alongside my mom for over 20 years, passed away from COVID in, I think, weeks 1 and 2 of social distancing. And they were not named by the media. The hospitals didn't release their names, obviously, because of like HIPAA. But I was getting upset that even they couldn't even name our dead. We have 1 in 5 nurses here in California are Filipina. In like New York, New Jersey, I believe it's like 1 in 4 Filipinos are in the healthcare industry. And so it's disproportionately affecting our community, and no one was collecting the data to show that. So that's what it was born out of. We want to make sure that our family members and our loved ones can rest in dignity, and also with the hopes that no one else has to join them in that way.
Yeah. I know before we started recording, I was telling you how I actually found out about the project through Tita Faye P. Coons. And when I went on the website, I recognized my cousin's godfather, sorry. And he was, he worked as a nurse for 20 years. He was already retired, and he came back to help because of the pandemic. And then he unfortunately passed away. I mean, that's just so sad, and then nobody's talking about it. And so I thought, oh my gosh, I need to talk to Jollene. And I know you have that similar experience, right?
Exactly. So my tita Rosary Olega Castro, she was retired, as well as Nilda Ronquillo. They were actually both retired, and Rosary went back to help. She passed away, and she leaves behind 3 daughters,
Oh.
a twin sister. She's just so young. And I keep thinking, I was sharing with you that I'm a union organizer of 17 years, and 12 of those years were in healthcare. And I know that we equip nurses with the ability to ask for more PPE when we can show the data that they need it, that Filipinos are dying disproportionately because their hospitals aren't providing the proper protective equipment so that they can care for COVID patients.
And I'm hoping that by this project that people will pay attention and also recognize and honor and be grateful for all of these people that are putting their lives before theirs. You know what I mean?
Exactly. I mean, what was it? May 28th, the CDC said that there were 294 healthcare workers that have lost their lives to COVID. 294. 74 of those are Filipino.
Oh my gosh.
We only make up 1% of the US population. And I was doing the math around it. So we're 25% of the COVID-related healthcare worker deaths, but we only make up 1% of the entire population in the United States.
Yeah.
So this is a crisis for our whole community.
Mm-hmm.
And the United States has double the reported COVID-related healthcare worker deaths than even the Philippines.
Oh my gosh.
The Philippines had 33. Like our last check of the data, and we have 74 here in the U.S. And the UK has more than the Philippines, right? So how are these countries treating our community?
Exactly. I mean, I know you come from a family of almost everyone is in the healthcare industry. I'm the same way. A lot of my cousins are nurses. They're working right now. How are you gathering all of the data, like from different states? Because I know you're local. You're in California, Southern California, but I know it's like the tributes are from all over.
So I think that journalists have played such a critical role in reporting the deaths. Every single name on the website, they were added after confirming from two sources that they both passed away and that they're of Philippine ancestry. So that's from the UAE deaths to the US to the Philippines. So literally scouring the internet every single day. I made it a point to like check every morning and check every night. There are 6 of us that worked on it. Ninochka Rosca, a writer, and novelist, journalist from New York City. Charlene Sayo, who's based in Canada. And so she really took the lead because there have been several deaths in Canada. Charisse Yanit Nadal, who is, we call it on again, off again adjunct professor. So she helped a lot with the research. Grace Regulano, who is the research and analytics data director at United Teachers Los Angeles. So that like live map.
Right. I saw that on it, yeah.
She made that with the raw data. And then, the paintings, those beautiful paintings, they're so gorgeous. So Iris Goncalves Strauss, when she was invited to be part of the project, she's also in a firm. She just basically stayed awake for 2-3 days, and that's what the website inspired.
Wow.
Yeah, so we had some other allies, but that's like the team size. Someone named Sai helped us build like the actual website.
Do you have any problems like getting that information? I know you were mentioning before we started like HIPAA laws and everything. Or so, do you think there's even more healthcare workers that have
Absolutely. I was sharing the other day that I have several names that I've just put aside because when someone posts about it on Facebook or when an article, like for example, there's a healthcare worker in the UK, a porter that passed away. And I clicked on the article, his face popped up and I was like, this guy is Filipino. But I couldn't, to this day, I still haven't added him on there because I can't find the sources that actually like confirm that. We want to make sure that like the data is able to be used in like medical journals, by academics, by journalists, and so we want to like protect the sanctity of the data. And journalists have been like the key. It's either journalists or the family members themselves who are submitting the tributes. Like we've gotten like several tributes from family members, and that's how we've added names to the website.
Yeah. I know you've received tributes. You've also done research on a lot of the heroes. Any of the stories that you want to share that just, I mean, I'm sure they all broke your heart, but just anyone's?
I feel like I'm getting emotional thinking. So my aunts passed away. So obviously, like I get emotional when I read the tributes to them. But there was actually one in particular that made me cry. His name is John Alagos, and he was only 23,
Oh my gosh.
and he was a new nurse. He was a new nurse, and see, can you imagine like spending your whole life studying and
Mhm.
being out of college for like 1 year and then passing away because you don't get the proper protective equipment? He was healthy. um so when I was looking for a picture of him, I had to like stop because I can't imagine how his parents feel. And I don't know, he had like his whole life still, and he passed away at 23.
Wow. And wow. Sorry.
Me too. It's been really rough doing the research, but I feel like we owe it to them
Yes, for
to
sure.
properly name and honor them.
Thank you so much for you and the rest. I mean, you have such a small team, just taking this on, and isn't it all volunteer? Yeah,
All
right.
here, and we're all working, so we would like wake up early to talk and work on the weekends and talk late at night, do the researching late at night. But I feel like it's worth it. I mean, no one else is gonna name our people except for us.
Yeah. And what do you hope to? What's your goal with the Kanlungan project? I'm sure you have many, but please share.
My goal is actually for people to visit the website to make sure that their loved ones are named and honored. That's like number one. Like, I want to make sure that this is a place that everybody can submit to. And I also hope that folks that need data to do their work, right? Like organizers that are asking for more PPE in the hospitals, protective equipment, nurses who are asking for more protective equipment in the hospitals, porters, janitors, everyone in the hospitals, clinics, and nursing homes can use the data. And then I also hope that writers and academics and journalists could use the data so that they can continue to write about what's happening in and to our community. Um, uh, so that's it. I mean, without journalists like you, we wouldn't have known, right? We wouldn't have known about all these people.
Yeah,
And so I hope that it continues on that way.
yeah, because if you don't do it, if we don't do it, then no one's going to hear about it. And then we're just kind of leaving them behind after all of the work that, our healthcare workers are doing. And it's the least that we could do, I
It's
think.
the least that we can do. I
Yeah.
mean, we haven't we haven't hugged our mothers. My husband and I haven't hugged our mothers since, when was that? March?
It's
Since
early
March.
age. Yeah.
Each of our mothers have been tested for COVID at least a minimum of 3 times each, because they're still practicing nursing. They're registered nurses, as well as like both of my sister-in-laws,
Oh,
right? So our families, their sacrifice continues when they come home.
yeah.
And so I feel like the least that we could do is name those that weren't able to make it.
Yeah. I agree. I mean, people talk, people always talk about numbers and the people that are getting sick. And it's like, and then they're like, oh, some people even say it's not that big of a deal. And it's like, do you understand? Our families are in the healthcare industry and what they're doing. If you were to get sick, who's going to be helping you? Like, recognize, right?
I just think about like when I saw the early protests about reopening,
Yeah.
people were upset that they said that their freedoms were being curbed because they couldn't get a haircut or because they couldn't eat in a restaurant. And like the first thing that I thought of was all of our moms,
Yeah.
all of our sisters that are caring for patients that have caught COVID, right? Like you say your problem is that you need a haircut. Like our family members' problems is that they don't have enough masks and they have to treat you
Yes.
when you are already symptomatic and you have COVID,
Yeah.
right? So it's a very different experience that I think the Filipino and Filipino American community is experiencing during the pandemic.
Yeah. What can we do? What can I do? What can others do to help you, the project?
So I appreciate this. That's the first thing I hope more people access. We've got like thousands of folks that have visited the page just like within the first few days of it being released. But we hope that it goes even more global. I think that there are people in 41 countries that have visited it. And we want to continue that because we know how many countries Filipinos have migrated to and provide care in. So that's the first thing. If people see that a name should be added, you could do that two ways. There's a tab to submit your story, and there's also a tab to submit a tribute. So that's basically it. We just want to tell people's stories.
Yeah.
And we hope that the data could be useful. And then we also hope that we did a decent job in honoring people's loved ones that have passed away.
Yeah, I think so. I don't know anybody else that's doing what you're doing, all through volunteer. Just 6 of you, a handful. With all this work and all this data and research, it's not, with your full-time jobs and taking care of your families. So thank you so much. Where can we go? What's the website again?
Sure, it's kanlungan.net, KANLUNGAN.net. And then if folks want to visit our organizational website, Ninochka, Iris, Charisse, and I are from a firm. So that's AF3IRM.org.
Yes. Thank you so much again for what you're doing. Thank you to the whole organization, AF3IRM. I mean, you guys are always behind everything that needs to be spotlighted.
Thank you so much for having us, and thank you for like boosting the website.
Yes. Take care. Come back. Keep us updated.
Take care. Bye.
Again, for more information on Kanlungan, please head to the website on the screen. I'm Kat Iniba. Until next time, take care and be safe.